But when you talk of blastomycosis, then is a small chronic granulomata, always round and has some sort of pus signifying the purulence or exudative nature. Normally, it is destination is the pulmonary stage that's frequently followed by spreading to other parts of the both sides, but chiefly this plastomycosis can be identified uh, on the skin and bones. The fungal agent that causes blastomycosis disease is what we call Blastomyces dermatitidis. Blastomyces dermatitidis. So the disease may really take long to establish itself, and it is also restricted to North American continent. In recent years, some few cases have also been, identified in Africa, Asia, and Europe. So once it is confirmed that you know this kind of disease, you have this blastomycosis, once it is suspected, we know that this now can be checked in the lab to know and confirm the disease. We can do what for when some of the presentation, for example, is a pulmonary blastomycosis as a clinical presentation. And at this stage, um, the pulmonary lesions are asymptomatic. You may not know because at this stage they are not very pronounced, and again you cannot detect them. Only start worrying when the infection spread to other organs, where others start now developing the symptoms after a period of around 3 to 15 weeks. That's a whole 4 months. It's when one can start sensing or realizing that there's a disease, and by that time, the mycosis, blastomycosis, could be spreading out of the pulmonary to other parts of the body. So once that has been done, some of the clinical symptoms within this pulmonary blastomycosis stage, you have cough, fever, malaise, and weight loss. And when the lesions become more extensive with the continuous suppression and suppuration and eventually necrosis, then that has now to be handled more quickly to realize, and prevent the disease and treat. If not, the patient will proceed, the clinical signs will become high, like high fever, chills, productive cough, muscle, you know, muscle and joint pains, a lot of sputum when somebody coughs, because the lungs are really and those esophagus are really being affected, and the lung, the mucosal level layer is affected, releasing a lot of mucus. After 2 to 3 weeks, somebody might, or the patient might appear to, to improve. But if this is not managed at that level, it will now move from pulmonary blastomycosis to cutaneous blastomycosis. This is where the this plastom this agent now spread through blood circulation and spread to other parts of the body, giving those what we call lesions within the internal organs. And this happens into over 70% of patients. But most of these lesions, they tend to be painless. They are not so much bothering to the patient, you know. But you could easily see this, ulcers or wounds on the face, upper limbs, neck, and scalp of the patient. Again, at this stage, number two, cutaneous blastomycosis, if there's no treatment, um, the clinical presentation will proceed again to a level of what we call osteoarticular blastomycosis. This is now where occurs in about 30% of patients, where the spine, the pelvis, cranial bones, ribs, and long bones are commonly involved, uh, are affected. But again, at this level, if the patient is not very keen, they remain asymptomatic until the infection spreads into what we call contagious joints or into adjacent soft tissues. That is when now a patient will start feeling there's something unusual in my body, because of the pain, the fever, and all that. Um, Apart from this osteoblastomycosis, other clinical symptoms can come in, including genitourinary blastomycosis, which involves the prostate, epididymis, or testis. Because of this hematogenous spread, it can also go to the brain, affect the meninges, spinal cord, and that. Um, the last bullet there is just to emphasize that people who have immune system compromised can easily develop what we call fulminant or full-blown plastomycosis with the widespread spread dissemination following endogenous reactivation of previous infection. So that's very common to people who are immunologically challenged. For diagnosis, just like the first three that we talked about, take the skin scraping, sputum and bronchial washings, cerebral spinal fluid, bone marrow, urine, take them there, and even a biopsies to the lab for checkup. Say interpreted a positive culture from any of the above specimens should be considered significant. Do not ignore anything because these are very, very serious pathogen. And again, a disclaimer, you must work under a properly fitted, appropriate uh, safety cabinet. Very important.